Hello, everyone. I'm Dr. B, and I'm a part of Homeopathy 24/7 team. We are a group of homeopaths from all over the world, and we practice online exclusively for our clientele. So I have been given this, I think it's an impossible task, of talking about fertility and homeopathy in a short video of just 10 minutes. So let's see how much am I able to convey in this short time. I'll try to talk about a couple of different things, a couple of different angles that we can look at fertility from in homeopathy. So the beautiful thing about treating fertility issues with homeopathy is that we don't just look at the physical manifestations of the diagnosis itself. We are able to look at the fertility issue from a holistic point of view. And I think a lot of you know that homeopathy is a holistic therapy and that we are able to look at cases in very different angles as compared to the conventional medicine. I'll be talking about those various angles and why and how are we approaching fertility in homeopathy particularly. I'll try to also give an example of a case where we used homeopathy with success, and it might give you a little bit of an idea about the extent of how the scope of homeopathy, the sheer scope of homeopathy in these conditions. So let's start with, the physical manifestations first, because that is something that everybody is always looking into, the blood tests and the ultrasounds and the ovarian cysts and, uterine fibroid or the retroversion of the uterus, etc., etc. So many, physical symptoms that could come associated with the fertility challenges that we are facing today. So all of that, yes, we obviously will be looking at those associated complaints when we are looking at a case from the homeopathic standpoint. We are not going to ignore, what is the main pathology if it is presenting in a case of infertility. But at the same time, as I see cases and I've been practicing with women's issues and fertility issues for a while now, what the kind of cases that come to homeopaths, I want to talk about my personal experience, of course, and not just what the book says, But so the kind of cases I was saying that come to a homeopath, they are very, sometimes there is no pathology that we are looking at, Sometimes people come saying that they have looked at everything, everything is looking normal. Where should we go from here? The fact is that in conventional medicine, when they look at fertility, they are only looking at the pathological manifestations or the physical manifestations of the disease. And when they find a reason associated with the condition on the ultrasound or on the blood reports, they try to give you the solution to that through the various methods that they have in their therapy. But a large majority of conditions today, a large number of cases, I would say, in my experience at least, people do not know why they are not able to conceive. Because Nothing is coming on the blood test. Nothing is wrong health-wise. Both the partners are doing very well. There is no specific etiology that's coming forward in those cases, and they're trying for, years and years, couples are trying to conceive, but even with normal health, so-called normal health, of course, because the tests are all normal, they are not able to pinpoint the reason for it, right? So these are the cases that homeopaths are looking at with a lot of success. I'll tell you, I'll want to, I don't just want to talk because, it's, as I said, it's an impossible task to tell you everything and to cover a lot in a short span of 10 minutes, but I'm still going to try, and I'm going to share my screen and show you something here. Just give me a quick minute. All right, so this is my screen, everyone. I hope you can see it. Right. So I have already put it there if you see miscarriage, right? So this is just miscarriage represented in our repertory. Miscarriage due to drugs or narcotics, with distension of uterus, emotional excitement. So that's a very important thing for a homeopath. You can just see the sheer extent of the kind of remedies. I just changed the page as well. Can you see that? So this is just about miscarriage, right? Then let's see, very interesting. Let me search sterility, right? The common term for fertility issues is sterility. And if you see male sterility, 47 remedies. Grief, sorrow from sterility. This is the mental state again. Profuse menses in sterility. Menses scanty in sterility. Sterility with discharge of mucus after coition. Sterility from leukorrhea. That's the white discharge that usually females have. Sterility that is from atony of the ovaries or uterus, etc., etc., etc. Sterility is psychotic. Can you see all that? And then there is sexual desire, which is mentioned with sterility, which can be high, which can be low, and the remedies are different, right? This is like the most, what I've shown you is the most basic. I haven't gone into the materia medica yet at all. This is the most basic rubric representation of the most common rubrics associated with this condition, right? So I'm just trying to tell you, we want to know everything. We want to know your menstruation. We want to know about your sexual desire. We want to know about what happens during coition, after coition, before. Coition is sexual intercourse, right? And most importantly, your history. I cannot emphasize it enough. Your history is something that we really, really want to know in detail if we want to treat a case of infertility, because if there is a history of any drug that has affected your reproductive system, if there's a history of a disease that you have had in the past, you've been treated for it completely, but today, still you're not able to conceive, it can be related to a history of, let's say, typhoid. It can be related to a history of tuberculosis. It can be related to a a variety of mental states like grief. Grief can be due to so many things. Could be obviously the death of loved ones. If you've been, if you've suffered in that way, then the remedies are different for you. And we are looking at a different kind of sterility or infertility, right? What I want to sum up, like I don't have, my time is up. what I'm trying to sum up for you in this video is that fertility is a very, very deep-seated condition, and it is related to so many, it could be related to, like for a homeopath. I'm not talking from the conventional perspective at all, because they will completely refute that if I said that it is related to the mental state of the person. How is sterility affecting the woman or the man? Um, what is the history of trauma in a particular case? What was the childhood like of a particular patient? If I actually said that to a conventional gynecologist or another doctor, they would probably completely refute it. But as a homeopath, I know this 200%, that these are related factors to today's rising percentage of cases of infertility. And if we do not look at it from a holistic perspective, uh, those kind of cases are very, very difficult to treat just following the conventional methods. So when you're going to be, if you're thinking about, deciding to work with a homeopath or not, I'm just trying to show you the extent of information that a homeopath needs to be able to treat these kind of cases. And they are not easy cases. Sometimes even a homeopath can be completely confused that what is relevant in this case or what not. But it is all about working comprehensively from a holistic point of view to solve these kind of cases. And it's really successful today, because so many homeopaths, not just myself, so many homeopaths are treating this condition with a lot of success. And we do not leave your body full of toxins. We do not leave your body full of we do not leave your pregnancy full of the artificial hormones, and we do not leave those kind of side effects when you treat with homeopathy. It's completely natural, and it's beautiful, the way a baby is born with homeopathy. I myself am a big example of that. I have a history of multiple miscarriages, and I did try to work with a gynecologist. It was very early when I just started practicing. And I did not know as well that, I should just use homeopathy for that. And I'm a living example of someone who was not able to conceive successfully. I have 2 kids right now, and they have been completely and exclusively on homeopathy. So I can vouch, for this from a personal standpoint, and that is why I'm so, so passionate about this, that you do not need to take those harsh drugs for conception, for a healthy conception and a beautiful pregnancy. I hope this was helpful for you, and I hope you'll share it with anybody else who's probably looking into uh, homeopathy, who's probably struggling with this condition, as it can actually take a physical and emotional toll on patients. Uh, and I really hope we can reach out to maximum number of people, with homeopathy, and help them with a very healthy and perfect conception. So I'm signing off. I will leave my details with the video on my website, my social media pages, etc., etc. You'll have all that information. And you can shoot me an email if you have any question, any query, and you're most welcome to get in touch if you would like that. All right. Have an amazing time.